Welcome to Wednesday's edition of COVID-19. We are back up at an unsettling high of over 700 new infections today. Authorities are calling for public caution and have vowed to step up prevention measures within the academic arena. Now, we have details on this and on current vaccination efforts later on in the program. Let's start now with the pandemic numbers with Kwon Soa. So Korea has marked a rebound today.
Yes, Sunny, quite a big surge we are seeing. And also we're seeing quite a similar pattern like last Wednesday. If we take a look at the number here, 731 infections were reported as of 12 a.m. And if we go over to our graph here, that's exactly the same number we had last Wednesday, which means we had a jump from the mid 500s to the 700s in just a day. Now, breaking it down by domestic transmissions and imported cases, there are almost 700 domestic cases, and we're also seeing a rise in cases from abroad. And with that, the average in domestic cases in the past week stands at 619. So despite the rising number of infections, though, we are still seeing a single-digit number of fatalities, with a total of 1,806 people having lost their life due to COVID-19 so far. So authorities have been highlighting that the death rate here in the country is lower than in many other countries, standing at 1.56%. Now, small to mid-sized cluster infections are still occurring nationwide. We've got triple digits in Seoul and Gyeonggi-do province, both with over 200 infections. And many of these cases were linked to clusters at private gatherings, restaurants, as well as a cafeteria at a middle school and a university.
I see. And speaking of schools, Soa, like I mentioned earlier, the government is looking to take further action within the learning environment to prevent outbreaks there.
Exactly, Sunny. The Education Ministry announced this Wednesday it will designate a special 3-week period beginning today to thoroughly inspect COVID-19 prevention measures in and around schools, that is, and also expand PCR testing. Here's Education Minister Yoo Eun-hae with the details.
Starting in the hard-hit capital Seoul, nurses, biomedical technicians, and other professionals will be visiting schools in teams of 3 to provide advanced COVID-19 testing for anyone who is asymptomatic but wants to get screened.
And more precisely, this means that within 1 kilometer of education facilities, including kindergartens, universities, as well as cram schools, faculty members, students, as well as after-school instructors can get tested for COVID-19 if they wish to. Around 2,000 infections among students and teachers have been confirmed in a month and a half since the beginning of the new spring semester. Officials also called for vigilance at home, with earlier family transmissions found to be responsible for more than half of all school-related outbreaks in March.
I see. Meanwhile, so on the vaccination front, I hear Korea is speeding up its daily inoculations.
Right, Sunny. Yesterday, I mentioned that over 120,000 people have been vaccinated on Monday, and on Tuesday, we see that over 130,000 people have received a shot of either AstraZeneca or Pfizer vaccine. And staying on the vaccination front, the European Medicines Agency concluded on Tuesday that Johnson & Johnson's Janssen vaccine has possible links to rare blood clots, but maintained its stance that its benefits outweigh the risks. And we will have experts discuss the issue further in a bit. But first, let's take a look at the global figures. We've got India with another resurgence in cases, with over 290,000 cases reported in the span of 24 hours. And also Turkey has now over 61,000 cases reported in a day. That's similar to the number we're seeing in the U.S. And with that, the world now has a total of 143.5 million cases, and we're also seeing a jump in daily infections, which stood in the high 600,000s just a day ago, and also a resurgence in the fatality rate with 14,526 deaths reported as of noon Korea time. And those are the updates I have for now. Back to you, Sunny.
All right, so as always, thank you for the updates. Right, now for more local coverage with regard to recent virus trends and our vaccination campaign, I have Abby Lee here in the studio with me. Welcome, Abby.
Hi.
Right then, now we mentioned this briefly on Tuesday, but authorities have underscored the risks posed at fitness centres. Let's start with that.
Sure, sounds good. So the KDCA on Tuesday revealed cluster infections at indoor sports facilities are on the rise. During the regular afternoon briefing, the in-house experts shared a simulation of how such cases can take place. The simulation was created using computational fluid dynamics. Let's take a look.
The simulation you're seeing here shows the spread of the virus 2 minutes after someone sneezes in an enclosed space without proper ventilation. We have studied the structure of the fitness center in question as well as the CCTV footage and conducted interviews with the staff members who were present.
So far this year, 40 cluster infections were reported at such facilities, with the total number of infections surpassing 1,100. The average number of cases per cluster stands at 29. When looking at the regional trends, there is a clear contrast between the Seoul metropolitan area and the rest of the country. The infection rate is on the rise in the capital area and on the decline elsewhere. Fitness centers or gyms are the main culprits, responsible for 18 cluster infections this year. Other high-risk venues include dance halls and sports academies.
I see. So what is fueling the clusters being reported at these venues then?
It's not so simple. It's a combination of so many factors. Infected visitors continue to frequent the venues after developing symptoms and engage in activities that raise the likelihood of droplet infections. The activities usually involve heavy breathing, chanting, cheering loudly, which is very prone to having the droplets go everywhere. Poor ventilation and failure to comply with social distancing rules also contributed to the fast spread. To curb the rise in the infections at indoor sports facilities, the KDCA recommended ventilating the venues more than once every 2 hours, and for both the staff and clients to adhere to mask and social distancing regulations. It also urged citizens to stay home if they were experiencing any symptoms that may be linked to COVID-19.
But of course.
Sounds simple, but hard to practice.
I know, Abby. Now, do tell us a bit about the latest with regard to post-inoculation repercussions then.
Sure, let's do that. So nearly 12,400 people have reported symptoms that were classified as unusual after receiving the inoculation. But 98% of those symptoms were muscle pain, headaches, fever, and nausea, which are all common symptoms to any vaccines. Some 120 cases had suspected links to anaphylaxis, including muscle spasm, and 49 cases of deaths. Anaphylaxis is a serious allergic reaction caused by hypersensitivity to foreign proteins or drugs. When someone is suffering from anaphylactic shock, it can lead to severe or fatal systematic reactions, often in the form of respiratory symptoms, lightheadedness, itching, and hives.
Right, I believe we have time for one more story. Let's talk about a joint effort between Seoul and Washington on the vaccine front. What's this about?
So Seoul is looking into a vaccine swap agreement with Washington. And here is what Foreign Minister Chung Eui-yong had to say during a parliamentary session Tuesday.
We are holding very serious discussions on the matter with the US. The issue was a key focus in my meeting with John Kerry, the US Special Presidential Envoy for Climate.
Kerry visited Seoul last week, but detailed information about the deal is still under wraps. Chung did not elaborate on what a swap deal means, and neither did Foreign Ministry spokesperson Choi Young-sam. The spokesperson reiterated, though, that his government is making multifaceted efforts in terms of vaccination coordination with the US. Sources said one of the possible options is to strike a loan deal with Washington. That means South Korea will receive vaccines the US is not using and gives the same amount back after the country is provided with its own supplies. The US has similar deals with its neighbors. White House spokesperson Jen Psaki said last month the country has 7 million releasable doses of the AstraZeneca vaccine and was working on arrangements to loan 1.5 million doses to Canada and 2.5 million doses to Mexico. The AstraZeneca vaccine has yet to be approved for use in the US. That's all from me today.
All right, Abby, as always, thank you very much for the update.
Thanks for having me.
Right, on the international arena, Sweden's COVID-19 numbers are among the worst in Europe and notably higher than those of its neighbours, Finland and Norway. Also, in recent days, there's been a surge in the number of patients in intensive care. For more on the situation there, I have Catherine Edwards live on the line. Hello, Catherine.
Hello.
Right, Catherine, do start with the COVID-19 situation in Sweden for us.
Yes, well, as you say, Sweden is now at a high point in now its third wave of the coronavirus. In total, more than 14 or almost 14,000 people have died in the country throughout the pandemic. And at the moment, the daily and weekly death toll is at a relatively low, stable level. And that's because more and more of the vulnerable population are now getting the vaccine. But the spread of the virus itself is still very high. As you say, it's one of the highest in Europe at the moment. The incidence rate over the last 2 weeks was almost 800 new cases per 100,000 people. So um, many times higher than Norway and Finland. And the really worrying thing is the pressure on intensive care units with admissions at the same level as they were during the second wave.
Right, I was just going to ask you, Catherine, how is the Swedish healthcare system coping with the mounting burden of new infections?
Well, for now, it's coping. There are enough, sorry, there are enough beds for everybody and enough staff available, but it's putting the healthcare sector under severe pressure. They've been working hard for a year now, and in some regions, they've got more people needing treatment for COVID-19 even than last spring when the situation was at its worst here. And that also has an effect on ordinary healthcare because people are still getting sick with other things. So, for example, several regions have now had to put on hold all non emergency or non essential care due to outbreaks in the hospitals or simply because there aren't enough staff and they're all having to focus on this crisis, in some cases, transporting patients to other parts of the country because the hospitals or the intensive care units are full.
I see. Meanwhile, Catherine, earlier last week, I believe one Swedish region declared personal lockdown amid a surge in daily tally. Could you tell us a bit about this?
Yeah, so throughout the pandemic, the Swedish government and the health authorities have relied mostly on voluntary measures. So there aren't any laws regulating how many people that you can meet privately or have round to your house. People have just been asked to keep social contacts very low, work from home if you can, limit travel, and of course, stay home if you're feeling sick at all. Um, and although some things have changed in recent weeks, so there are things like limits on the number of people who can enter a shop or a gym or restaurants, all those places are still open, but they're becoming more strict on social distancing. But some regions are now just making their wording sharper because they don't have the power to change the rules, but they're trying to stress how important it is. So using the words go into a personal lockdown. In other words, just don't meet anyone outside your household and don't go out to these places even though they're still open.
Right. Catherine, what has been the general public response to the lax approach adopted by the Swedish authorities in containing the pandemic then?
It really depends who you ask. I think Sweden has, like the other Nordic countries, quite a strong tradition of having high trust in the public authorities and a belief that they'll do the right thing. So that's why they were able to rely on these voluntary measures. Over the past year, we've definitely seen the trust levels, as measured in surveys, follow the development of infection. So when things are bad, as they are currently, that usually comes with a dip in trust. And you have a lot of people who are angry and feel that the government should have stepped in more and not just relied on individuals to make decisions when it's this important. But you also get some people who are happy that Sweden has kind of safeguarded personal liberty and that they've been trusted to make these decisions and been allowed to live with some degree of normality, more so than in other countries.
I see. Meanwhile, Catherine, how are public inoculations proceeding in Sweden, and what is the official stance with regard to the use of vaccines linked to very rare cases of blood clots?
Well, Sweden procured the vaccines as part of the EU joint procurement scheme, and the rollout at the moment has been delayed because of delays in the deliveries to all EU countries. At the moment, I think it's in most regions over 65s can get the vaccine. You can see here, this is Stockholm's City Hall. It's usually a popular tourist attraction, but has now become a vaccine centre for healthcare workers and for the elderly. And when it comes to those vaccines with these reported rare side effects, the AstraZeneca vaccine is now being recommended only for people over 65 because most of the side effects were reported in younger people. And the Johnson & Johnson vaccine at the moment has been completely put on hold whilst they await for more information. So that's further slowing down the vaccination. It's currently almost or just above 1 in 5 members of the adult population have received at least their first dose, and this is mostly the most elderly.
I see. All right, Catherine, thank you very much for being with us at this very early hour to end.
Thank you.
Right, back on the local front, an urban landmark here in Capital Seoul is hosting a cultural event amid hopes for a productive vaccine rollout. Our Jessica Lee is out on site. Hello, Jessica.
Good afternoon, Sunny.
Right, so Jessica, tell us where you are.
Yes, today I'm at Dongdaemun Digital Plaza, which is known as TDP as well here in Chunggo District. Dongdaemun Design Plaza has 3 basement floors and 4 upper floors. And here it's located right next to the Dongdaemun, Seoul's mecca of fashion. So this landmark is staging various international events, various international conferences, and also forums, and it hosts a lot of cultural events and exhibitions. So here I'm today to introduce to you a very special exhibition that's being held here in DDP. So let's go inside. So before we have to check the temperature, and I also sanitized my hand before entering DDP here. And the number of in-person attendees per hour is limited through online advanced reservation system as well. So as you might have noticed, it's being operated under strict COVID-19 prevention measures and hygiene measures. So we are now able to enjoy the exhibition. The exhibition that I want to share with you today is titled K-pop and Hanbok. Hanbok, Korean traditional attire, is getting a lot of attention as being interpreted into a new and modern style. So some of K-pop singers wear hanbok on their stages or on their music videos. It's getting a lot of attention all around the world. So here we have 25 hanbok pieces are on display, and these hanbok outfits are worn by K-pop stars such as BTS, Poland, Zico, or Oh My Girl. So let's take a look at this one. So this one is actually the hanbok that's worn by BTS member Jimin. So take a look at here. It's a combination style of Korean hanbok pants and Western slacks. And take a look at here. Extra folded front fastening is designed to make dancing much more convenient. So it is similar to traditional hanbok, but it has a slight difference of it. And let's see this one. This is the hanbok suit that's worn by BTS member Sugar last year in Kunjeongjeon in Gyeongbokgung Palace. So it's a fabric, design, color, and patterns. Most of everything is reinterpreted to a new and modern style. So we did take a look at 2 hanbok styles of BTS, and now let's take a look at this one. This is a female hanbok. It's flower patterned, it's pastel toned, and this hanbok is worn by Oh My Girl on their broadcast stage. And it's pretty and cute, and you can see the skirt is a little bit shorter than the traditional hanbok. So I think I'm saying this several times today, but these hanbok outfits here in the exhibition are not traditional hanbok. It's a new style, it's new fashion item that has been transformed for K-pop singers. So we did take a look at some of the hanbok outfits here at the exhibition, and now let's have an official from the exhibition and have a talk. Good afternoon.
Good afternoon.
Thank you for joining our show. It's really interesting exhibition, and I want to ask a question. Why is this exhibition being held? So what's the initial purpose of it?
Well, along with the high popularity of K-pop, the Korean celebrities hanbok all have also attention in the world. In this exhibition, you can see 25 hanbok pieces, and also you can feel the modern beauty of hanbok. Well, unfortunately, because of the COVID-19, it is difficult for many people to visit in this exhibition. However, we prepared an online exhibition too through the Kakao Gallery. So we hope many people join for our beautiful hanbok. Thank you.
Thank you so much for your time and your words. So actually, the Korean wave and K-pop comforted people around the world who are tired of COVID. and exerted great power in culture and art field. And through this kind of exhibition, we are looking forward to seeing the Korean wave and K-pop and of course Hanbok becoming a more widely recognized, loved, and known by people around the world. And for your information, you'll be able to enjoy this exhibition from home online as well. So please check it out and have a great experience. So this has been Jessica Lee reporting live from TDP, and back to you, Sunny, in the studio.
All right, Jessica, thank you for that coverage. To our viewers, we also do apologize for the subtle disruption in audio connection there.
현재의 발생 양상을 보면 여전히 가족, 지인 등의 소규모 접촉과 지역의 집단 감염이 주요한 감염 경로입니다.
Folks, I have good news. Everybody is eligible as of today to get the vaccine. You have enough of it, you need to be protected, and you need in turn to protect your neighbors and your family. So please, get the vaccine.
COVID-19 infection numbers are rebounding here in Korea, as is the case worldwide, amid the threat of variants, vaccine supply shortages, and safety concerns over some products. Here in the studio for this, I have Professor Kim Moon-gyu from Yonsei University. Good to have you back, Professor Kim.
Thank you for having me.
And I also have Dr. David Kwak from Soonchunang University Hospital. Welcome back, Dr. Ta.
Good afternoon.
Professor Kim, as mentioned earlier, Korea has recorded more than 700 new infections over the past 24 hours. How do you assess our current COVID-19 situation?
It should be lower, but the mortality did not increase and it remains low. It used to be high in the January, reaching 22 per day, but till now it's a single digit. So it might be because of the vaccination, and still we have some hundreds of cases, but if we maintain like that, I think we're going to follow the pattern of Israel or UK, because there was a drop of mortality first after they started the vaccination program, and then the confirmed case started to decline. And if we look at the recent data of Korea, I think about 60% of the cases are below age 50. That means they are active socially, they have to work and meet a lot of people. So I think they're the major group getting infected. And if I move to the issue about the imported cases, I think the imported cases mainly come from Asia, and this area is not the area with some new variants like South Africa or Brazil. And I think if we have a variant, I think they are mostly UK variant, which is called Kent variant also. So we should speed up our vaccination program, and that will be the prime goal for a couple of weeks.
Right. Dr. Kwak, as mentioned earlier on the program, fitness centers have led to more than 1,000 cases since the start of this year. How do you explain this finding?
Well, so it's really the obvious. As we've said numerous times on this show already, the virus spreads through air, and when there is confined space, especially underground, where the aerosols cannot escape, it's going to stay there and cause other people to be infected while staying there. So, and many of these gyms, they happen to be underground without any ventilation system, specifically, sorry about that. So it should have been probably expected from the get-go that all these underground places, all these places without windows, they need to be more sought after to be prevented for any further possibilities. I guess now we're learning. So from this point on, I guess we should take extra care to look after these certain places that have confined spaces, physical barriers, and whatnot. As probably seen from the segment before, within a confined space, it doesn't matter if a person stays 2 meters or more apart, because the aerosols, the virus that is spread out from the person, will be able to stay longer in the air and will also be able to reach a person who's further apart. So I guess we, in the sense that physical barriers, we just have to be extra careful going into these places, but also governmentally, they should probably take extra measures to keep better control of the spread through these places as well.
Right. Meanwhile, Professor Kim, what are your thoughts on the pace of Korea's inoculation drive?
Well, since now we inoculated about 1.6 million people, at least they had the first shot, and if we include the second one, it's going to be 0.6 million. I think it's similar to other Asian countries which had a good quarantine measures. So the good news is the nursing hospitals, nursing homes, they're already vaccinated more than 80% of their people. But if we consider the total population, they vaccinated people as only 16% over 75. So we have to speed up with that risk group. And government is planning to make more vaccination centers recently, and they're going to booster the vaccine program. At the peak influenza season, we have a data that we vaccinated 2 million in a day. So if we could reach that level, we will be speeding up the program. And I've no doubt that Korea is going to reach 40% of the population. But I'm afraid that we might go to a plateau after that, because this was the case for Israel and UK. I mean, there are some groups reluctant to get vaccinated or hard to reach. So I wish that government to make a plan proactively, and if we reach that level, we should move on to the next target.
Right, and staying with public vaccination efforts, let's turn to efforts over in the US, where authorities have reportedly fully inoculated a third of the adult population. I have Professor Peter Chin Hong at the University of California, San Francisco, live on the line. Pleasure to have you with us, Professor Chin Hong.
Thanks for having me on, Sunny.
Right, Professor, could you start by telling us a bit about the vaccination campaign in the US, where teenagers, I believe, have also been included?
Yeah, so as of Monday, all individuals over the age of 16 are now eligible for the vaccine. In the US, like in Korea, it was a tiered system. So nursing home residents initially, then those over 65, then those with comorbidities. So I'm very pleased and excited and grateful that now all individuals over 16 are now eligible.
I see. And how is the rate of vaccination there, Professor?
So we're up to about more than 3 million doses per day now after a very sluggish start. President Biden, when he took over office, pledged at least 100 million doses in the first 100 days of office. He's now set to exceed 200 million doses in his first 100 days. So I think he's always under-promised and over-delivered, and I think setting realistic expectations has been a welcome hallmark of this new administration.
Right. Dr. Kwak, do you believe Korea needs to include its younger population in its vaccination plan, like in the US?
Well, I'm very careful on the topic of including youngsters in the vaccination program. Obviously, eventually, when we have clinical evidence that it is safe to inoculate vaccines to all generations, then I am more than happy to say that I would 100% agree to include the whole population, per se, within a country. But at least for the time being, we have very limited clinical trial evidence to include younger generations at this moment. But also, more importantly, we're barely getting through the older generations with the stocks that we currently have. So these topics that we currently talk about will be much later in the future, if at all, if it becomes possible. So I think at this point, we really need to focus getting everybody that are within the age group that we're targeting to be inoculated at the moment.
Right, a valid point, of course. Professor Chin Hong, the accumulated number of COVID-19 cases per 1 million people here in Korea stands at 2,200 as of the start of this week, and the vaccination rate stands at 3.15%. What are your thoughts on these findings here in the country, Professor Chin Hong?
Well, I think where Korea is, and part of the reason why there might be a more sluggish start to vaccinations, of course, is that there wasn't quite a sense of urgency as in UK, as in the US, when we were seeing hospital systems overwhelmed, stretched to the limits, healthcare personnel were being very burnt out. So I think that image really etched into the minds of Americans to get vaccinated very quickly. So even because we've had almost 50 times the number of cases per million compared to Korea. So if you think of that image, that's a good enough explanation. So in terms of where I think some of the obstacles in Korea are for vaccination might be the fact of, again, not that sense of urgency as in the US, given the really well way that the Korean public health authorities has handled the COVID pandemic in the country, and maybe a little bit of warm weather, bringing the folks out, maybe as some sense that social distancing might be a little bit more relaxed. I think some of the things that are going well is that the pace of vaccination is increasing rapidly. I think folks are realizing that to open up to the rest of the world, and with the specter of immunity passports looming, that the Korean population needs to get vaccinated if we need to have a world economy that's free and open.
Right. Professor Kim, the European Medicines Agency says there is a possible link between Janssen's vaccine and very, very rare cases of blood clots, but that the gains of the vaccine outweigh the risks of the potential side effects. What are your thoughts on this stance, and how does this stance look to affect Korea's inoculation drive?
EMA reported that there are more benefits compared to harm if we use the Janssen vaccine, and they say that the cerebrovascular thrombosis happens within 3 weeks, and all of them are less than 60 years of age, and it happened 8 cases from 7 million people, and it is slightly higher than the natural incidence of thrombovascular thrombosis. But anyway, precautions should be added on the product because it might decrease the platelet counts and cause thrombosis. So I think the process of Janssen vaccine is going to be similar with AstraZeneca, and we have about 300 cases of cerebrovascular thrombosis since we started the vaccination, and mostly from AstraZeneca vaccination. But I still agree that there are more benefits compared to harm. And at the beginning of the childhood vaccination program, we started with DPT and other vaccines, but a long time ago, we had a similar phenomenon like this. But anyway, there were more benefits because those bacterial infections are very fatal. So if we can prevent most of them, we should endure some harms getting from that vaccination. And I hope that our government will make a precise indication, like an age group for Janssen vaccine or AstraZeneca, so we can go on with this vaccination to booster the vaccine program.
Right. At the moment for the AstraZeneca vaccine, it's below 30 that cannot receive it, right?
Yep.
I see. Professor Chin Hong, what looks to be the fate of Janssen's vaccines in the US?
Well, Sunny, the CDC of the US is going to meet for the second time on Friday. But what I'm predicting is that they will reapprove or unpause the rollout of the J&J vaccine. There are so many advantages. You don't need that ultra cold temperatures to store it like Pfizer, Moderna. It's one dose, one-stop shopping, can be used in mobile vans. But I predict that it will be restricted by age group, possibly over 65, like what was done with AstraZeneca in much of Europe.
I see. Dr. Kwak, now this is the second scare of rare blood clots following the first link to AstraZeneca. What do we know thus far about the cause of these very, very rare post-inoculation reactions?
Well, frankly speaking, we don't know much about why it is happening. There have been a couple of studies out of Europe that studied people who had this phenomenon, and then they found that they were having a very similar antibody reaction to the, as aforementioned, Dr. Kim mentioned, heparin-induced thrombotic thrombocytopenia, meaning that these people who were having these issues were showing higher antibody levels against what's called platelet factor 4. But none other than that, we really don't have too much knowledge of, meaning we still have to factor in what about the natural occurrences that could have happened? What exactly in the vaccine might be causing it if it was to have a causal relationship to the blood clotting? So it's still in the dark clouds, but also, as Dr. Kim mentioned, I also want to reiterate the fact that the numbers that are occurring from these vaccines only slightly exceed that we would have seen from a natural occurrences. So I hope that media shows the most accurate depiction of what's really happening, that it should not be overly emphasized, but it should not be underemphasized either, of course. But people should not be overly scared about what's happening, but we should all really rather try to have an as objective eyes on this matter as we can.
Right. Professor Chin Hong, back in the US, I understand officials are looking into the possibility of booster shots. Could you tell us a bit about this?
Yeah, so about 5 days ago, the Pfizer CEO had a press release saying that, or predicting that population should need a booster shot in about 12 months after the double series of shots. That was met with some skepticism because, again, we have no information from the original trial participants that they've had waning of antibodies. In fact, the most recent 6-month data show still more than 90% efficacy. So I think if we are going to have a booster, it's going to be for variants, not for waning of immunity to the current available strains that we have, or current available variants that we have.
I see, fair enough. Professor Kim, while some countries are lucky enough to be thinking about getting an extra shot, others, like Korea, of course, have yet to secure their basic vaccine supplies. What are your thoughts on this?
Well, first of all, we have to think how long this vaccine is effective. And for the perspective of antibody, we say it's going to be about 6 to 8 months. But that's not the whole picture. We have T cells, which might fight against the virus, and we don't know how long it's going to work. So definitely, I think it's more than 8 months. And the need for booster is different from the variants. I mean, if it's the previous one, or if it's from South Africa or Brazil, the need for booster is going to be different. And for Korea, the situation is a little bit safe than the United States. So there is a possibility that we might need the booster in the future, but I think right now it's low. And if we think globally, I think the priority should go to the unvaccinated group first. And sad thing is, vaccine supply is mostly following the market approach. And since we have a COVAX facility, it's not working effectively. And I wish that the international society and the vaccine companies regard vaccine as a public goods. So it's going to be distributed more ethically and properly.
Hopefully in the very near future. Professor Chin Hong, I hear COVID-19 vaccination is also possible at neighborhood pharmacies in the US as opposed to special vaccination centers set up here in Korea. Now, has the availability of diverse vaccination sites had an impact perhaps on the rate of inoculation in the US?
So, Sunny, the need for diverse sites was really driven by equity. Most of the bad deaths and severe COVID was seen in vulnerable populations, not just minority populations, but those of low SES, socioeconomic status. So the aim was to really meet them where they were. So if they went to a drugstore, if they went to Costco, if they could get to a big site like a stadium, that will be, or in a health center, that was really the approach. I think in the beginning it was very rocky because it was multiple streams and people were very confused. But right now I think it's settled down where, with sit-in drives, mobile vans, etc. Again, with more forgiving vaccines like J&J, they're sort of reaching these more vulnerable populations.
Right. Dr. Kwok, back here on the domestic front, variants continue to raise concerns now. Having said that, what are the risks of the double mutant from India, and what can we do to better control its potential spread here on the local front?
Well, not much is known, again, about the double variant that is compared to maybe single variant, as if we are going to talk about it. It's only the factor that double variant means it includes two different variants that are possibly from two different continents or countries. As can be seen in India, they found cases where people were having a variant from the United States, along with a variant also from the South Africa, meaning one virus is containing both the variants on the same virus. Would that cause more harm to us? Maybe, maybe not. We just don't know yet because we just haven't had enough clinical trials to see if it was more transmissible or if it was causing more severe disease in the end. But in a sense, protecting us from still the variants. I believe the Korean government already has taken a step towards that by mandating all people from these countries creating variants to be isolated in a social facility as opposed to having them before them being allowed to stay at their homes or other facilities. Let me correct myself, it's not homes, but other facilities for 2 weeks. So I think that's the first step, creating a physical barrier so that the virus cannot cross the border is probably the most important thing and the easiest thing that we can do. But obviously there would need to be many more researches done on these variants to see if it actually would cause more severe diseases and also medically how we can fight against it. So those are, I guess, the homeworks that we have at hand.
Right. Professor Chin-Hong, what is the latest with regard to the presence of variants over in the US?
So there have been a few cases of the Indian double mutation variant in California, but by far the variant that is really becoming dominant is the UK B.1.1.7 variant. It went from about 5% or less than 5% in January, and now it's accounting for about 44% of cases in the US. In many states, but California, Florida, others, it's very predominant. But the variants that I'm most afraid of are the ones that not just are more transmissible or might cause more severe disease like the UK variant, they're the ones that also might have more vaccine evasion, particularly to AstraZeneca. And those include the Brazilian variant, particularly P1, and the South African variant. So, and above all, my comment is, we know about these variants, but the variants I'm most afraid of are the variants not invented yet. So today, for example, in Texas, there was a new variant already described with very similar mutations of the receptor binding domain. So again, the variants of the future, I hope that we can all get vaccines equitably around the world, COVAX on board, not worry about these risks like blood clots. You're more likely to get struck by lightning than to get these blood clots.
Right. Professor Kim, what is needed to allow for a productive balance between public inoculation and COVID-19 prevention going forward?
Before we had a vaccine, that was season 1. And since we have the vaccine, we started the season 2 of this pandemic. It's like rabbit and turtle racing. And the virus is running away, and we have to catch up like a turtle. And as I told you, it's like fighting against the moving target. And government should reduce unnecessary quarantine measures because the public is getting tired. But we have to focus more on the indoor quarantine measures before summer. The reason why I emphasize some more is I remember that there are many cases of outbreak because of the air conditioner. And I don't know exactly, but the coronavirus might survive longer in that kind of situation. So I hope that before the weather gets hot, we have to control better. And government should set a level of herd immunity, and we have to reach that target. And I'm afraid that some countries are using this pandemic politically. I wish that the Korean government would exclude any political agenda and just focus on the fight against COVID-19. And the general population, people should keep the efforts of the quarantine measure as we did until we reach a safe level of herd immunity.
Right. As always, Professor Kim, thank you very much for your words.
Thank you.
Dr. Kwak, thank you for being with us today. And Professor Chin Hong over in the US, thank you very much for your time and your thoughts.
Thanks so much.
Right now, let's keep in mind that vaccination is not the end of our fight against the pandemic. Do seek to make prevention a priority. Thank you for watching.
We use plastic